If you've ever had back, hip, or knee pain, chances are you've heard that you've got a weak glute med, and you need to do exercises like the clamshell, but it often doesn't work. The main function of the gluteus medius is to abduct, which is to take the leg away from the body. It plays a key role in hip stabilization whenever you're walking or running. It has to work hard whenever your leg is in front of you, beside you, or behind you. And that's the problem with classic glute med exercises. They only work the muscle in one direction, which can leave you feeling stuck forever. Think about it. If you do all of your strengthening exercises with your legs side by side, and then you suddenly find yourself with your leg in front or your leg behind, and there's no strength there, that's a pretty big weakness. Unless, I suppose, you want to walk sideways forever. In this video, we're going to show you the 3 most effective drills for long-lasting results when it comes to strengthening your glute med. The 3 concepts are strengthening abduction fully, pelvis stabilization, and full hip health. We need to keep the multi-directional functions of the glute med in mind as we're doing our exercises. So you may have seen some of these before, but we're going to make slight adjustments to them to make sure that we don't miss anything out and accidentally only strengthen one direction. Let's get stuck in. First thing we want to do is fully strengthen our hip abduction. So what we're going to do is a side-lying drill. So we're going to lie down fully, one leg out in front, and then we're going to lie on our arms. So from here, there's 3 different points that we're going to take the legs. You're going to do 10 in each position. So we're going to squeeze our glute here in the back leg. We're then going to lift up as high as we can. Once we've done that, we're going to lift up a little bit higher because there's always a little bit more there. So that's the way you're going to do your first reps. Full side of the foot on the ground. You squeeze the bum. You then go up a little bit higher. So that's the first one. So you'll do 10 in that version. Then we're going to rotate from the hips. So we're going to internally rotate at the femur here, and then our big toe is going to tap the ground. So heel off, big toe down. That's where we do our next reps. The leg is slightly in front of the body. We go as high as we can. We go up a little bit more. So you'll do 10 reps there. So again, high and then up like that, and then back down. And when you've done 10 there, you'll then go back, leg behind the body. Heel is going to touch now. So now we've externally rotated at the hip. The heel touches, we squeeze the bum, we lift as high as we can, and then a little bit higher, and then back down. This one really gets the butt. And then from here, back up, lift up a little bit more. So we're getting the whole side butt here. We're then going to finish with the final 10 reps of rainbows. So we start with the heel down, we lift up nice and high, and then we bring the leg over, trying to draw like a rainbow, and then the big toe touches down. So that is the 4 variations you're going to do. So it's 10 straight leg, up, up, then 10 toe in front, up, up, and then 10 heel behind, up, up, and then 10 of the rainbows. You're going to do that on both sides. If you're finding it super easy, or just as a long-term goal to build up to, we want to take all of these concepts and put them into a side plank position. So that way we're working on an isometric hold with the outside here, so the glute med's having to hold the whole time, and you can go through the full drill like this as well. So it's up, up that little bit higher, toe in front, up, up that little bit higher, and then foot behind, up, up a little bit higher, and then we can do our rainbows. So it's an awesome drill, works on the core strength as well. If you can get to this point, things are pretty strong, so you know you've done a good job. So 5 of each variation in that is really good. Then we want to take that drill to standing. Next thing we need to do is take the lying down drill to standing up. So we're going to do the exact same thing, only different. From here, the feet are going to be beside each other. I've planted my right foot, so I have a soft bend in both knees, right foot fully on the ground. And my left foot, I'm going to lift the heel up a little bit. From here, I'm thinking about trying to squeeze my glutes a little bit, and that's going to make your knees start to go out a little bit. From there, I'm imagining there's a big band around my knees and trying to spread it apart. So because my feet are stuck to the ground, they're not going to go anywhere, but I'm trying to do that with both sides at the same time. So I hold this as an isometric contraction for 5 seconds. So 1, 2, 3, 4, 5. Then I can relax that off. Next position, toe pointed slightly inwards and the femur rotated in at the top here. So I'm rotating from my hip inwards, and then from there I squeeze in again. Or squeeze in, squeeze out, sorry, so squeeze out. So that's the adductors, we'll come to that later. From here, we're squeezing out the way, and then from there, after the 5 seconds, we go to the 3rd position again, and we're here and we squeeze outwards. Big key point here is not to open your full pelvis up like this. You're looking to just rotate from the hip, foot slightly behind you. squeeze out the way. This is the one I feel the glutes in the most. So I'm squeezing outwards, and then you'll repeat that on the other side. So it's 5 seconds here with the feet beside each other, squeeze out, then 5 seconds with the leg like this, squeeze out, and then 5 seconds with the leg behind like this, squeeze out. Now, it's all well and good doing exercises when you're lying down or being still and being able to get the muscles to work, but we really need to have drills that are going to incorporate balance so that your body has to know how to correct wobbles and think for itself. So we're actually going to combine 2 exercises. We're going to do the hip hike single leg deadlift, patent pending. First thing that we're going to do is focus on the hip hike. So if JP can notice here whereabouts my knees and hips are, from here I'm going to hold on first. I'm going to bend one knee like this. The hip hike element is to lift my hip up. So now it's higher than the other one. Then I drop to level, so my knees should be beside each other, and then I drop a little lower into this hip so that now the knee should be below the other knee. Then I go to neutral. So this is a normal hip hike by itself. So it's up and then knee to knee and then hip lower than the other hip, all sinking into the standing leg. From there, when we level up, make sure you've got something to hold on to. I'm using this rig, but you can use a wall or a chair, anything you've got to keep balance, that's all we're after. We're then going to go, when the hips are level, into a single leg deadlift. We're going to load the hamstring of the standing leg, and then we squeeze our glute to bring the hip back through to standing. So one full rep will be hiking up higher, and then we drop the level, go lower, and then back to level, and then our single leg deadlift. When you do 5 of these, they start to burn like crazy. My bum already feels amazing from the other stuff earlier. But from here, we're back up, hike it up, level, drop, level, hips back and away. And you're going to repeat that on both sides, and you're going to look for if it's more challenging on one side than the other, and that can be a big area for imbalances as well. So we want to make sure that each side feels as close as possible. Once you've got it holding on, you then want to take it away from your wall or whatever you're using, and then do it freestanding. So from here, the foot's having to work extra hard, everything's having to work to be stable. We hike it up, so it's above, we go level, we go below, we go level, and then we do our single leg deadlift, loading the hamstring, making sure that the back stays straight. We squeeze our glute to bring ourselves back up. Another little key point about that single leg deadlift, make sure you're not trying to reach down as low as you can. It's about loading your hip, not trying to touch the floor. It's not a stretch. You're trying to load at the hip and feel that glute being stretched out, and then we bring it all back together. Lastly, we need to make sure that we're giving your hips a little bit of everything for full hip health. If we get caught up blaming one muscle or one area, we might miss something. We need to zoom out and look at the bigger picture. Not that far. You've more than 20 muscles that contribute to how your hips move overall. So if you get caught up just blaming that glute med, you are going to miss something. So imagine if you've got like 20 fires going on and you put out one, things are just going to take over. So we might get referred pain and all kinds of stuff. So what we want to do is think about how the hips move. So I'm going to hold on again. I'm just using this dumbbell. You can use a chair or anything you got. From here, I'm going to go up with the leg. So this is hip flexion first of all. So this is going to work on hip flexors. From here, we're going out. So we're abducting away from the body. So that's going to hit the glute med in that position. From here, we're internally rotating the hip, and then we're pressing back, squeezing that glute, trying to get a little bit higher again. Remember, there's always a little bit more there. And then we can bring the leg back down like that. So that's what one rep would look like. So it's up, out, internally rotate, and then back down. Now we go back in reverse with that. So we lift the leg up first as high as we can. We then rotate inwards, and then we bring the leg across the body back into that hip flexion position. So that's what one rep essentially is. So it's out, internally rotate, back down, back up, externally rotate, bring it across. So it's just moving your hip like a hip. It's a really nice exercise. The way to put a bit of isometric strength into that is to use your own hand. So you lift up and you try and push your own leg back down and resist yourself. So I'm trying to lift up into my own hand and I resist, and then I go out, and then I put my hand at the side of the leg and I push in to my own hand, and then I internally rotate, same idea, try and lift up into my own hand. I even feel this in the standing leg, And then from there, I bring the leg down and I squeeze inwards. So I work on the adductors. Remember I made that mistake earlier about squeezing inwards. I squeeze in and I work on the adductors in this position. And then I go back up. I try and push the leg down. I externally rotate. I try and push into the leg. And then I bring it across and I press back up again. So 5 each side with a little bit of isometric tension is absolutely plenty. Really nice to get all of the hip moving. It's such a good warm-up. Good one just to do in general. To structure a session, it will look like this. You're going to warm up with 5 hip cars on each side. After that, you're going to get down and do your lying down circuit for the 10-10, 10-10. After that, you're going to do the standing circuit for 5 seconds in each variation, and then you're going to finish with the 5 of the hip hike single leg deadlifts on each side. Aim to do these exercises 3 to 4 times per week until you find them much easier, and then you can just check in them from time to time every couple of weeks. Use them in your warm-ups or separate mobility sessions.